Hi, ladies and gentlemen. I am Dr. Sunil Kumar Gupta, Principal Director and Head of the Department of Hematomedical Oncology and BMT at Venkateshwar Cancer Hospital, Dwarka, Delhi. Today I would like to discuss you regarding the head and neck cancer. Why I am selecting this topic? Because head and neck cancer is a common disease seen in India in the tune of 33%, and you can say India is the capital of head and neck cancer globally. So today I would like to discuss head and neck cancer in a layman language rather than a technical or a scientific language to you. I want to convey you few important things which I want to discuss with you for head and neck cancer. I would like to discuss what are the signs and symptoms of head and neck cancer, what are the common causes of head and neck cancer, how you will diagnose the head and neck cancer in clinical practice, what investigation is required for diagnosis, and what is the treatment options, and ultimately we will discuss can we prevent this head and neck cancer in our clinical practice or in day-to-day life. So head and neck cancer are the cancer that impact the mouth, throat or other part of your head and neck. The most common sign and symptom of fatal cancer is persistent sore throat. It is possible to lower the chance of suffering from this cancer by quitting tobacco or tobacco products and alcohol and safeguarding yourself for human papilloma virus. This human papilloma virus is a commonly seen in the Western world, but recently in India this is reported in India also in head and neck cancer. Are you aware? This is very important question from my side. Timely diagnosis can aid in catching this cancer at an early stage and allow prompt management of head and neck cancer. Then we can talk about cancer is curative in an early stage. Today we will talk about the common causes, symptoms of head and neck cancer, diagnosis of head and neck cancer, how you will approach in such patients, and treatment options which is multidisciplinary in head and neck cancer like surgery, radiation, chemotherapy and other supportive measures. Head and neck cancer cases are rising at an alarming rate in the country. However, there is not much awareness regarding this cancer, and that's why today I am discussing with you the head and neck cancer which is commonly seen in North India, but you will surprise that this disease is commonly seen again in Northeast in the tune of 50%, where the nasopharyngeal cancer is commonly seen. Head and neck cancer began in squamous cell that are present in the moist and mucosal surface inside the head and neck, mouth, nose and throat. This type of cancer is called squamous cell carcinoma. The various other type of head and neck cancer are oral cavity cancer, oropharyngeal cancer, hypopharyngeal cancer, voice disease cancer is known as a laryngeal cancer, and nasopharyngeal cancer which is commonly seen in Northeast area, but now we can see few cases in North India again. Now I would like to discuss what are the common signs and symptoms, and you can easily identify whether patient is suffering from a benign disease or early changes of head and neck cancer. If you have a sore throat or an ulcer present in mouth which is not relieved by the treatment of roughly 2 weeks, maximum 3 weeks, always evaluate yourself for head and neck cancer. Apart from these prominent symptoms, few symptoms are so clear like change in voice, hoarseness of voice, unusual bleeding from the mouth which is not stopped, or a difficulty in eating and swallowing of food. There is a nasal bleeding, facial numbness, upper teeth pain, bloody saliva or a phlegm, sinus infection and jaw swelling, and sometimes there is a unilateral deafness reported in nasopharyngeal carcinoma. Then you will need an immediate diagnosis and treatment to rule out cancer in your body. It is essential to report any abnormal symptom to the doctor instead of suffering in silence. This message I want to convey you that head and neck cancer is a slow growing disease, and number of time patient miss this sign and symptom, and during this period the disease is passed to curable to incurable side. Now I would like to discuss about the risk factor which is causing head and neck cancer in our day-to-day practice. And just see, tobacco and tobacco product consumption in the form of smoking, cigarette, cigar, pipe, hookah, pan masala, beaten nut, chewing tobacco, snuff tobacco or dip with alcohol, and sometime human papilloma virus is one of the culprit of head and neck cancer. Sometime few patients are having a weak immune system. Genetic as well as family history of cancer can be one of the factor behind this cancer. It is essential to stay vigilant when it comes to the risk of this cancer. If you have any of these risk factor, then ensure that you are in the touch with your doctor regularly to rule out any chance of head and neck cancer in clinical practice. Now I would like to discuss about the screening and how you will diagnose the head and neck cancer. The disease is identified and diagnosed by clinical examination of the doctors. This is very important. Like any ulcer, any node in the neck is one of the clinical examination, but this is confirmed by CT scan of the face and neck or MRI of the face and neck, and if there is a doubt you can go for a fine needle aspiration known as a FNAC or a true cut ultrasound guided or a CT guided biopsy for tissue diagnosis of head and neck cancer. Now I would like to discuss about the treatment. Number of time people are unaware about that head and neck cancer is a multidisciplinary team treatment in the form of surgery, in the form of radiotherapy, in the form of chemotherapy known as a concurrent chemoradiotherapy, and if the disease is spread to the different part of the body, then palliative chemotherapy. But in a present era we are talking about the immunotherapy or a checkpoint inhibitor's role or a targeted therapy role in head and neck cancer. Even in nasopharyngeal carcinoma we are having a targeted therapy now in a recurrent disease which is approved by the Indian drug controller as a treatment options. So once we are talking about any treatment, this is totally depend upon the clinical stage, size of the tumor, the nodal status and final clinical stage. If early stage patients are having head and neck cancer and surgery is possible, our choice is surgical curative intent treatment. If patient is having a locally advanced head and neck cancer, we prefer instead of a surgery neoadjuvant chemotherapy and debulk the tumor and reassess after 2 to 3 cycles for surgical treatment option. But despite of that, if patient is inoperable, we can go for the chemoradiotherapy as an options, and chemoradiotherapy is known as a definitive treatment in such patients. If you feel that patient is having a age which is more than 70 years, we are having a biological agents now with the radiotherapy, so we can give a immunotherapy plus radiotherapy. Those patients, those who are not fit for systemic chemotherapy or some renal problem or some cardiac problem or a comorbid condition, where you can go for a immunotherapy plus chemotherapy. If the disease is spread to different part of the disease, we can go for a palliative chemotherapy or immunotherapy or target therapy as an option in head and neck cancer. We have different option in head and neck cancer. It's totally depend upon stage of the patient and recurrence of the disease and site of the disease of the patient in clinical practice. So how you can prevent head and neck cancer? This is $1 million questions. Head and neck cancer is a preventable disease. You can prevent this head and neck cancer by stopping or not taking tobacco or tobacco product or alcohol into your day-to-day life. Number one. This is very, very important. You can easily prevent. And oral cavity care is very, very important. The important thing which I want to convey you. Today it's an era of junk food. Most of the patients or even the families are eating junk food, which is one of the culprit of cancer in number of sites. So balanced diet is most important thing. Balanced diet means you should eat the vegetables, fruits or a whole grain which is required for your body as an antioxidant to prevent the cancer. Adhering to tobacco-free lifestyle, taking HPV vaccination, because HPV infections are reported more in Western world as compared to India, but if you are going for prevention by vaccination, chances of head and neck cancer due to HPV decreases or reduce. Regular screening is very important, and dental care is again a very important thing. If sharp tooth or a unhygienic condition again leads to oral cavity or a tongue cancer in clinical practice. These cancer, if you want to prevent, is important that you must care yourself in the sense of balanced diet, oral cavity care, avoid tobacco products and alcohol. Currently a large number of people neglect their health owing to create basically a erective schedule in life is one of the important thing. It is imperative to be proactive and take charge of your health by following a well balanced lifestyle, which is very important. And this message I want to convey you that you can prevent your cancer by taking this precaution. This is a carry home message from my side. Thank you very much for listening me patiently regarding the head and neck cancer in layman language. Thank you.